time to get at it. Oh!
Hey Spencer, how's it going?
Hey, Nurse Andy. How are you doing?
Good. How are you doing?
Trying to get back into working out.
Yeah, didn't you just have a heart attack about a month ago?
Yeah, right around 3 weeks.
Alright, I see you're working out pretty hard here. Maybe you should take a little rest here.
You know, I could use a smoke break.
Oh, I don't know if that's a good idea. How about we go talk about heart attacks and ways we can treat ourselves after having one to make sure we don't have another?
Okay.
Alright.
Yeah, that sounds good.
I got some colleagues that could also provide some information that would be useful.
Okay, yeah, let's
Alright.
do that.
Let's set up a meeting and we can discuss that.
Okay. Oh, and with COVID, it's probably a Zoom meeting, huh?
Yeah, we'll do it all online.
Okay, that works. Yeah,
All right.
let's do that.
Talk to you later.
Yeah, good to see you.
All right.
Hey guys, thanks for meeting with me.
Hey, no problem. Hopefully we can give you some helpful information. Allison, how about you start us off by talking about the pathophysiology of a non-STEMI?
Hi Spencer, thank you so much for coming in. So you recently had an NSTEMI, or a non-ST segment elevation myocardial infarction. Now what does that mean? An NSTEMI is a less severe type of heart attack which results with less damage to the heart. This occurs by having a partial block to one of the arteries of the heart, and it can also cause a lessened amount of oxygen in circulation back to the heart, which can cause unstable angina or chest pain. So this chest pain is caused by the low amount of oxygen being transported to the heart muscle. If there isn't enough oxygen for over 20 minutes, unfortunately, the cells in the muscle of the heart may begin to die, which can cause problems in the future because that damage is irreversible. Because this specific type of heart attack is less severe than others, treatment should be started within at least 12 hours to 3 days if you aren't experiencing any types of serious symptoms. Once again, thank you for coming in today, and the rest of the team will go over your lifestyle changes or any other treatments that are associated with this condition.
Thanks, Allison. Spencer, can you tell us a little bit about what you already know about non-STEMIs?
Well, now that you mention it, I do remember the signs and symptoms from the last time I was at the doctor's. So a person will experience severe chest pain that has not resolved with rest, changing of positions, or use of medications. This pain will be persistent, and people have described this pain as a crushing feeling with pressure, tightness, burning, heavy, and constriction. Common sites of pain include epigastric areas, substernal pain, radiating to the back, arms, neck, and lower jaw. I understand that some people may also have shortness of breath, nausea, discomfort, weakness, and feelings of indigestion. So, the doctor was explaining that the sympathetic nervous system and cardiovascular system are affected with an NSTEMI. This results in diaphoresis, increased heart rate, increased blood pressure, as well as clammy, cool to the touch skin. It's also possible that a fever can last up to 5 days, resulting from the death of the heart cells. While these are the signs and symptoms that a lot of people exhibit with an NSTEMI, the doctor also told me that it's possible for you to be asymptomatic during an MI.
Spencer, it sounds like you have a pretty good grasp on the signs and symptoms. Aaron, can you tell us a little bit about the different ways to diagnose a non-STEMI?
Hi Spencer, I'm glad that you can join us all here today. I heard that you had a question about how an NSTEMI is diagnosed. So in addition to symptoms like chest pain, diagnosing an NSTEMI is mainly through two different ways. So first, it's going to be through a blood test. And the blood test will show elevated levels of creatine kinase myocardial band, troponin I, and troponin T. So cardiac biomarkers such as troponin I and T can help assist in evaluating myocardial muscle damage related to an MI, since troponin is released from damaged heart tissue into circulation. So blood test alone can't diagnose a heart attack. So secondly, we're going to be looking at an EKG heart tracing, which an EKG records the electrical signal from your heart to check for different heart conditions. Electrodes, typically it's going to be 12 leads. 12 electrodes are going to be placed on your chest and body, and it's going to record your heart's activity. So if there's a pattern known as a non-ST elevation seen on the EKG tracing, this is known as an NSTEMI. So what that looks like, if you can see right over here, there's an ST depression, so non-ST elevation. And that's kind of an example of what it's going to look like on the EKG tracing. And it's going to differ with a STEMI. This is going to be elevated. So it's either going to be ST wave depressed or T wave inversion. And there's going to be no progression of Q wave. And the partial block of the coronary artery for the NSTEMI. So often when we look at the EKG, it helps us locate the area of the heart that's affected. Other ways that we can diagnose or kind of evaluate the heart is by looking at an angiogram for the blood vessels, or we can also do a CT or an MRI that can look at damage to the heart as well. And we also want to look at other lab values as well as assisting in ruling out other complications or disease. So looking at the hemoglobin, hematocrit to rule out anemia. We want to look at the fasting glucose, cholesterol for the potential risk of coronary artery disease, along with thyroid function to rule out hyper or hypothyroid, and C-reactive protein for inflammation, and B and P, which is assessing for heart failure. Always, but mainly it's going to be the blood test with elevated troponin and other cardiac biomarkers, along with the non-ST elevation on the EKG tracing. Thank you.
So after I left the hospital, I kind of lost my prescription and never picked up my medications. Do you think one of you guys could tell me about the medications and treatments for a non-STEMI?
Hey Spencer, so I hear that you have some medications from your previous MI that you need some clarification on.
Yeah, that would be great. Thanks.
Absolutely. Nurse Andy gave me a list of your current medications, so we can go over them now.
Sounds good.
Okay, great. So it looks like we have Nitrostat. That is a nitrate medication that is used to relieve chest pain. Usually before physical activity, you can take it to help decrease chest pain. And the pain occurs when your heart is not getting enough blood. So this medication will work by relaxing and widening the blood vessels so that blood can flow more easily. The next medication that you have is a beta blocker. This medication is going to block adrenaline, and it's going to cause your heart to beat more slowly and with less force. Some beta blockers work mainly on your heart, some work on your blood vessels, and those that work on your blood vessels will help dilate the veins and arteries to increase blood flow. And beta blockers can help improve symptoms with patients who've had an MI. Let's see what else you have. You also have a statin. This medication is used to help reduce cholesterol, and it's used to help prevent cardiovascular disease by reducing heart risk in patients with elevated cholesterol. And it looks like studies have shown that this medication has an anti-inflammatory, antithrombic property, and antioxidant effects. So it's used as one of the important medications to help prevent MIs. Your next medication that you got is Plavix. This is a platelet aggregation inhibitor, and it's used to reduce the risk of an MI, stroke, or unstable angina. It helps prevent further clots from forming. So and it also helps prevent clots from getting bigger. And also, just a little information, a patient who's had an MI, such as yourself, and who may be at high risk, can have some procedures done as well besides the medications, such as a coronary angioplasty and stenting. They also call it percutaneous coronary intervention, or a PCI. And this is where a thin tube is guided through your groin or wrist to a blocked artery in your heart. And once in place, this thin tube has a balloon that is inflated, and it will open up the blocked artery, and a metal mesh will be put in place, and this will help restore blood flow back to your heart. And you can also have a coronary artery bypass surgery, which involves sewing the veins or arteries in a place that's beyond where the blocked artery is. And this will allow blood flow to bypass that area and reach your heart.
That's some good information. Thanks.
Yeah, glad I could help.
Hey Spencer, I'd like to talk to you for a little bit about ways you can improve your cardiovascular health. Lifestyle modifications and medication compliance will be necessary to keep you healthy and free of serious complications of having another non-STEMI. The most important thing you can do is stop smoking immediately. Information about quitting should have been provided to you at the hospital before you were discharged. If you're still having trouble, smoking cessation counseling and groups are available in the community to help you out. Weight management is another important lifestyle modification that will help you prevent another MI. Eating a heart-healthy diet will help improve your cardiovascular health. More information about this can be found online through the American Heart Association website. Just check it out. A dietitian can also provide information and services to help you create healthy eating habits. Since you're diabetic, you should aim to have an A1C of less than 7.0. You should all make it a goal to reduce your blood pressure to 130/80 and your cholesterol to less than 70. Exercising is a good way to keep your heart in shape, but your exercises should be kept to a level that doesn't put too much stress on your heart. Check your heart rate frequently and make sure you're not overexerting yourself. You should probably tone down the weight and intensity of your workouts, and definitely stop taking all those pre-workout supplements. If at any point you're not feeling well, you should take a break. Listen to what your body is saying. Stress and anxiety reduction are also important to help you reduce blood pressure and the effects it can have on your heart. Rest and relaxation will help reduce stress and anxiety. Along with lifestyle changes, medication compliance will also prevent a future MI. You were given some medications when you were in the hospital for your last MI, and it's important to keep taking those medications as prescribed. I know I already told you about the signs of having an MI, but I want to reinforce it a bit. Basically, chest pain is the heart's way of telling you it's having trouble doing its work. In general, look out for pressure like substernal pain at rest or with minimal exertion that lasts more than 10 minutes. You should seek immediate medical care if severe chest pain is not relieved by rest, position change, or nitrate administration. Hope this helps.
Absolutely. All of you here have been a great help. I think I'm going to take better care of myself now. Well, I have to take off. I hope to see you guys soon. Have a good day.